Hello, ladies and gentlemen. Thank you again for visiting our website. I wanted to talk to you about getting ready for your lipedema surgery, what to do before, what to expect. First thing is we're going to start scheduling the lipedema surgeries once the approval from the insurance company has been completed and once we have all the things done from the standpoint of financials. All right. The patients need to go through preoperative clearance. It usually means getting blood work. We check for anemia, we check for kidney problems, for electrolyte problems. We also may need to make sure that you're not pregnant, and even if you have been in menopause or on birth control pills, we still have to check that. Also have to make sure that your blood clots appropriately. Also, the state requirement is to have a COVID test prior to surgery. So it has to be a COVID PCR. It's not a COVID antigen. If you're doing the surgery, the pre-op locally here, you're going to have all those tests done at the hospital prior to your surgery. Depending on your age and other medical conditions, you may need to have cardiogram and the chest x-ray done. Usually a day or two before, you'll get a phone call from anesthesiologists, from the hospital, from the operating room, and from us confirming all those kind of things. I'll tell you where to go, what to do, and how to prepare. Now, just in general, how to determine the day to do the surgery on. We do surgeries several days a week, and we do it based on availability. We schedule the surgeries on a first come, first served basis. If you have a specific time frame, the only option we have is to schedule you on a waiting list if you want to do it sooner if somebody else cancels. A preoperative plan is like this. First, you need to make sure that you're overall healthy, as we talked about clearance. Then, if you have any snuffles, if you have any urinary tract infection, we prefer to cancel, and actually we would cancel for safety reasons. If you still have periods and you happen to have period at the specific time of surgery, ideally we would like to reschedule. But if you cannot because of time commitment and so forth, you need to be aware that you will have more achiness, pain, more swelling, and the whole experience is going to be not as smooth as it could have been otherwise. Now, the day before surgery, you will need to do several things. First of all, you need to start taking certain herbal medicines that we recommend. First one is arnica. Arnica comes as the ointment or cream, as a tiny little pellet, or as a capsule. The cream really is not practical because we're operating on the large areas of skin. Capsules are good, but some people don't like them because they're a little bit too big. The little supplements that go under the tongue, probably easier tolerated by everybody else, and you just put them under the tongue, 3 or 4 things, 3-4 times a day. You start one day before, and it helps your body to prepare and for trauma, and then decrease the amount of bruising. The second thing is bromelain. It also comes as a tablet. And the third is a combination of papaya and pineapple enzymes. I don't suggest you drinking huge volumes of pineapple and papaya juice. You won't be able to get the same level of enzymes as you need to. Now, the day before surgery, you need to prepare the area where we're going to be operating on. And what you do, you need to take a shower, and then you need to purchase Hibiclens soap. It's a red soap. You can buy it at the majority of the grocery stores or drugstores, and it's similar to the surgical solution we use in surgery. And you wash the areas that we're going to be operating on with that soap. We don't want you to wash the whole body with soap because it's very drying. You use it only for the areas we're going to be operating on. So you can take a full shower. If you're doing the legs, you go from waist down, and you do the Hibiclens wash the night before and then the morning off. Please use a douching solution, whether it's summer's eve or whatever preference you have, the evening before and morning off, just to make sure that you have proper hygiene down below. Do not shave your hair. If you want to shave it the week prior, but don't shave it right prior to the surgery, because sometimes we use hair as a guideline for, say, for example, tummy tuck surgery, something like that. You do not eat or drink anything prior to the surgery starting from midnight. You continue to take all your medications with a sip of water. If you have any specific questions about the specific medication, if you should take it or not on the morning of surgery, call our office or discuss it with anesthesiologists whenever they call you prior to surgery. All right, so that's before the surgery, what you expect to do.